Are you dreaming of a nose job but don't have the dough? Thinking about breast implants but can't figure out financing? Would love to get liposuction but aren't sure if a bank loan is too risky? Understanding the how-tos of paying for plastic surgery can be confusing, but it's important to know that in this multi-billion-dollar industry, many plastic surgeons are willing to work with patients to develop a plan that involves paying off the procedure gradually.
So we offer financing through my practice. I think it's an important option.
Dr. Tiffany McCormack thinks it's important to offer her patients the ability to finance a procedure through a medical plan offered at her office. McCormack says she wants to give her patients the option.
Even if people have the money, they don't necessarily want to put it all out for a procedure at that time. So I think it's very reasonable to offer financing.
Experts advise those patients who elect to use financing to be aware that interest rates and finance charges can be high unless there are certain breaks offered for those who have a good credit history. It isn't an option that every plastic surgeon encourages. Some think cash up front is always the best choice.
We feel like when a patient has saved the money and they're ready to do the surgery, that's the right time. Oftentimes when people finance things or they take on more than they can handle, sometimes it can lead to a less optimized outcome.
It's a choice that every patient has to make. What's the right path to pay for plastic surgery? Some may decide on a bank loan. There are also companies that offer credit plans. Whatever the decision, experts say it's always a good idea to start with a budget.
We do try to counsel our patients and find out what budget they're working on. I think that there's a difference between doing a blue plate special collection of surgeries versus prioritizing a patient's needs.
Veteran plastic surgeon Dr. Kevin Smith says it's possible to get a great end result even if a patient who's a little strapped for cash needs to scale back.
You know, if a patient with a limited budget comes to me for facial rejuvenation, say, perhaps they can't afford a full, complete facial rejuvenation with a facelift, but perhaps a smaller cost, lesser downtime procedure like an eyelid surgery, blepharoplasty surgery.
Experts advise that plastic surgery should be treated like any other big purchase in life. It's best to explore all options and plan ahead, including the selection of your surgeon. It's important to know what payment or financing options your surgeon may or may not offer or accept, and then decide what's the best path for you. For the Plastic Surgery Channel, I'm Dawn Tongish.